Do omega-3s cure depression? Let's get right to it, motherfuckers. Yes, in some cases it does. Actually, in a lot of cases, omega-3s have been just effective as antidepressants for a lot of people. Talk about studies a little later. Also, when you take antidepressants with omega-3s, high EPA formula, which we'll talk about in a second, the results have been incredible for a lot of people. When you mix and match, combining, the natural stuff with the pharmaceuticals, you get this incredible combined serotonin heavy supplement that just makes you feel great. So let's talk about this for a minute. Omega-3s. I've got my laptop out here because you know what? I could pretend I know about this stuff right off the top of my head, but I don't. I'm gonna research a bit and see what this is all about. Just my personal experiences, I take omega-3s almost every day. Pretty much every day. High EPA formula. Okay guys, omega-3s not only help brain function and all that great stuff, also studies that it helps prevent cancer, heart disease, diabetes, great for your joints, kind of lubricates your joints for arthritis, joint pain, did I say skin? Anyways, it does all sorts of great things just from little fishies. They usually come from cod, salmon, and what are those little ones? Anchovies. So I want to read a little bit of a study here. Again, I take the omega-3s high EPA formula. For the studies that have been done thus far, patients seem to react when it's 1,000 milligrams of EPA or more. Below that, nothing really happens. There's that 1,000 milligram or 1 gram mark that really improves their mood. Let me share a little study with you. A Norwegian study of nearly 22,000 participants revealed that those who regularly took cod liver oil, which is rich in omega-3 fatty acids, were about 30% less likely to have symptoms of depression than those who did not. Cool. How about this one? At the Royal College of Surgeons in Ireland, the effect of omega-3 fatty acid supplementation was studied in 49 patients with repeated episodes of harming themselves. In addition to standard psychiatric care, study subjects were randomly assigned to receive 1,200 milligrams of EPA plus 900 milligrams of DHA or placebo for 12 weeks. At the end of the treatment period, the group receiving omega-3 fatty acids had significantly greater improvements compared to those with the placebo in scores for depression, suicidal thoughts, and daily stresses. Pretty cool studies. Now, that's just 2 studies, and what was that? 23,000 people out of millions? So you know what, with these studies, you can't say, oh, it worked for them, it'll work for me. Even if those studies said 100% of the people who took omega-3s felt better instantly, it still may not work for you because that's a fairly small sample size. I personally take it. I think it helps. I really think it does. Calms my anxiety, depression, I feel great. So I could tell you guys about the science, but to be honest, I don't know the science. And scientists know the science, so go to science.com and check it out. But for now, what I've read is that omega-3s, your brain is 60% fat. Okay, so we know all about, eat the good fats and not the bad fats. Those nuts that are good in omega-3s, those almonds. Take the fish oils, don't eat the bacon grease. They're doing so much research on these omega-3s because some consider it like a miracle pill. It's just fish oil, but it does work wonders for some people. What they're saying is that, the omega-3 and the fat kind of wraps around these neurons and creates kind of an elastic membrane and just helps them communicate with each other, neuron to neuron. Long story short, talk to your doctor about omega-3s, ask him or her, what's it about? I heard the EPA formula is great. DHA, they've said, is more for, a memory boost and cognitive improvement. The EPA is more for mood fuck am I saying? Mood. The EPA is more for mood stuff. My brain's not working today. Hey, maybe I should have some omega-3s DHA. But again, guys, talk to your doctor, do some research. Naturopaths are out there. It's definitely worth looking into. Now, if you take antidepressants, most of the time, you can have the omega-3s. Sometimes the omega-3s have actually turned out to decrease some of the side effects from the antidepressants and make them actually more effective. So look into it. Highly recommend it. Omega-3s, baby!